Hello and welcome to the special online edition of Carte Blanche's COVID-19 Q&A, where we ask health experts some of your burning questions surrounding the coronavirus pandemic, like how to ensure your personal safety as well as those you come into socially distanced contact with. I am Masa Gegana. Remember to click on subscribe so you don't miss out on any of our upcoming episodes. Today, we are focusing on protective masks, dispelling some of the misconceptions and getting some conclusive answers as to who should be wearing a mask, what type of mask, and why. We also have a very important demonstration teaching you how to make your very own protective mask right in the comfort of your own home. Joining me on the call is our guest health expert, Dr. Shabir Moosa, who is a family physician and a professor in the Wits Department of Family Medicine, as well as a doctor who volunteers at the hotline number that you will see on screen throughout this discussion. So, without further ado, let's get right into it. Prof. Moosa, if you could please explain to us the difference between the types of masks we have out there, who should be wearing a mask, and when we should be wearing a mask. And I'll tell you why I also asked this, because the other day I went to our local shop and I happened not to be wearing a mask. And I felt judged by my fellow shoppers. I felt judged by the people who were wearing masks as if I should be wearing one. So if you could please explain, when should we be wearing these masks and in what situations?
Thank you, Masa. I think that when you saw me at the first, it probably looked intimidating. And I think that we want to get people used to the idea of masks. It is going to be the new normal. It doesn't need to be boring. It doesn't need to be intimidating. And I hope we can actually make it a fashion statement. Well, let me just talk about masks. I think firstly, people need to understand that how a cough works and how infection works. So when we cough, sneeze, laugh, or talk, we actually send out of our mouths small particles in two different forms. One, it's actually a fine thing that stays in the air. And this is something that we can't even see. It's very tiny, and it's virus particles. They tend to be hanging around the air. That's called aerosolized. And these hang in the air, but they actually disappear, especially in a place that is open, ventilated, that kind of goes away. Although in a closed space, like a lift, for example, it can stay there for up to a few hours. But another form of the things that come out of our mouth is, in fact, a droplet. And I'm sure we've all experienced teachers who are talking, and we're at the front desk where they're kind of talking and things are falling out there on us. And we kind of say, ugh, what is going on with this teacher? Well, we all actually do that. That's called a droplet. And in fact, that droplet falling onto surfaces all around us land up, and especially into our hands, land up on surfaces which we then can touch and pick it up. Now, those things on surfaces, the droplets on surfaces can last for days. And that's the danger. That's the real problem. So the aerosolized is actually few and a little bit, but it doesn't last long. The droplet lasts a lot longer. So the masks that we have are actually 3 or 4 different types. And people get confused by the language. I think many people hear of an N95 mask. The other one is called an FFP2. If you look at the label FFP2. You also get some called KN95. All of them are actually 95% of the virus particle they tend to catch. Now, these are what's called respirative masks, which are, you might say, protective and used for healthcare practitioners. Of course, people say, I want that, and it's fine if you have plenty of it. But under the circumstances, there was a study done by Smith in 2016, which found that the other mask, which is commonly used and used by medical practitioners, is a surgical mask. It usually is the one with the straps tied at the back, and it has a blue or green surface to it that's suited to try and reduce the virus inhalation. Now, the third mask that's come around is, in fact, the question of cloth masks. And I think that increasingly, people have begun to find that in the COVID-19 outbreak, and Lee in 2020 published this in Science, saying that they in fact are finding that up to 80% of the people who have COVID, get COVID, are getting it from people that don't show signs. And in fact, in an article in Lancet by Feng 2020, he suggested that everyone should wear a mask leaving home. The big difficulty is that we can't wear masks, all of us. And I think we can't all wear N95. And I think it would be stupid of us to actually try to wear N95 or even surgical masks. We need the doctors to have it. And we please beg you, please give those masks to the healthcare practitioners, your nearest clinic, because they desperately need that. Just handkerchief alone had the effect of reducing it by 30%. So it actually is useful to bring it down by a third, especially by someone who's coughing, and in fact, all of us, because we don't know whether we have it yet. So we need to think slightly differently. It's about not me being protected for myself. It should be, I'm protecting you, you're protecting me by wearing a mask. Researchers in Cambridge, and again, people are using this study to say cloth masks are useless. But in fact, that study by Cambridge found that about 57 to 73% of protection was achieved by just using a single layer of dishcloth, t-shirt, pillowcase, and linen to make a mask much like I've just put up here, just like this. If you actually double the layer, which makes it 2 layers, you can go from 83% to 97%, which is just as good as a surgical mask. And you can, now, unfortunately, the surgical mask, the sort of masks from tea towel, dishcloth, is very difficult to breathe. So the recommendation is to go for pillowcase or 100% cotton t-shirt, which achieves a pillowcase a 62% protection of letting this virus go out, and 71% of this coming out, the virus coming out from you. If you stick a paper towel in between, it goes further to 23%. So wearing a simple fabric cloth like this will protect you, but increasingly we want everyone to wear it because it's not about protecting yourself. It's about, if you have the virus, can I protect the other person? So I think that I hope gives you a sense of what is happening. So we have a campaign, and I think there is a Masks for All campaign, excuse me. And in that we are trying to, let me just share my screen so that you have a sense of what I'm talking about. This campaign, I think, is getting steam all over the world, and I think it's a great idea. But it is very important that we think how that works. This is my blog, profmoosa.com. I urge every one of you, go there. And we actually have 3 principles. We want the community to be responsible. Donate all your masks to healthcare workers in the public service. Make fabric masks for those who are sick in crowded clinics and township households. The other point that you raise, I think that is very important, is that it does not mean because you wear a mask, that's it. You have to wash your hand. You have to manage that mask very well. You've got to make 2. You've got to actually try and wash them and use the next one. Washing them is not very complicated. It's simply a soapy wash in warm water. And then after that, the important thing to disinfect it is a good, strong iron. That's all. And anyone in South Africa, even in a township, has got an iron. The iron is what you need to do. No boiling and whatever else. Just iron them nicely. And then use them carefully, because when you go out, if you are coughing, so you need to remind that you don't touch either inside or outside, and manage that very carefully. Throw it in a plastic bag and make sure that's how you're going to wash even the stuff you wear if you are going out into risky places like a taxi, etc. And I think that we need to say to people, please don't jump in a crowded taxi for your own safety. Say, I'm sorry, I'll take another. And wear these masks, don't touch another. When you get out, you must actually use sanitizer, getting in, getting out. Because anything you touch is potentially a surface. And if people are not wearing a mask, look at them and tell them, why aren't you making your own? I made this myself. And if they wear a surgical mask, tell them, please, my friend, give it to the clinic. Tell them to use it. Don't waste this, make your own, and educate each other about the fact that fabric masks are very easy to make and they're wonderful ways to do it.
I love that you mentioned also that we can make a fashion statement out of this. You can use an old t-shirt, you can use whatever fabric that you have in your own home. I mean, look at that. I actually want to wear one myself.
Yeah, they're lovely, aren't they?
They look really pretty. So I want to know how to make one myself. And I'm sure our viewers also want to know how to make one of those pretty masks for themselves while protecting themselves as well. So we're going to move on to a quick demonstration that shows you how to make your very own protective mask from the comfort of your own home.
Experts recommend that the best material to use when making a homemade mask is a double layer of 100% cotton. So an old bed sheet works really well, but in this instance, I'm using an old cotton t-shirt to make mine. So I've got 2 hair ties, my old t-shirt, and a pair of scissors to make my mask. This is how you do it.
And there you have it. It's really not that difficult to make your very own protective mask at home as long as you have the necessary materials. I hope that really does clarify a lot for many of us. It really does clarify a lot for me. I will be making my very own mask from home today. I'll tell you that. I'm going to have fun with that. So, Prof, we are entering flu season right now. Yeah. We're entering flu season. People have coughs, we have the sniffles, we've got runny noses. We are on edge, we are paranoid. Should we go and run and get ourselves tested as soon as we start coughing or showing any slight symptoms? Are we not burdening the healthcare system and putting too much pressure? Or should we rather just self-isolate and treat it as a normal flu until otherwise? When should one get tested and where?
That is what we need to think about. So let's just go through the characteristics of a person at risk. Well, in terms of testing, at the moment, you have to have that disease for at least 14 days or less. If it's more than 14 days, you should actually be thinking about TB, which is actually just as important a disease. And if we continue wearing masks after this disease, we will bring the TB rates down in this country. So other than that, it is about saying, well, I've got this flu. It's been less than 14 days. Well, if you have contact, and our close contact is not I just passed someone. It means that you somehow were within 1 meter of the person and for more than 15 minutes. That means contact. And if you had that person as a confirmed, in other words, they said, I had a test and it says positive. Or the person has been to the doctor and the doctor's still saying, we want to get a test for you, but I think you may have COVID. And then you've somehow been in contact with them. The other thing that could be a reason, now all of these are O's, is that you might have traveled. Now, right now, because everybody's traveling, that travel is really less because lots of people are now having local transmission. It's not so important. If you're a healthcare worker where somehow somebody's treated positive, that doctor, that nurse needs a test, especially if they have a flu. And the other reason is if you're admitted with severe pneumonia. So that brings me back to the question that if you are going to really need a test, if just rush into the clinic because you have mild symptoms, you're actually going to just overwhelm the clinic. So I advise you very strongly that you look at your symptoms. If your respiratory rate is less than 25, don't stress, because that means you've probably got either mild or flu. But I think that all of you who have that flu, treat it as COVID. Go home and isolate. Sit in one room, try and find your way away from other people. Don't use the same materials. Don't, that's clothing, food, utensils, bathrooms. Think about ways in which you can just be aware of the touching, because you could have avoided COVID. But don't go test. Don't go out and say, I have to go test. There's no point. Because all you're doing is reducing the test for those who need it. And the people that need it are healthcare workers and those in hospital who have a breathing rate of more than 25. When you go with the doctor with that rate of 25, the doctor will decide, and he'll do what's called a oximetry. He'll check the oxygen. Are you getting enough oxygen? And if it is less than 95, you're going to be needing either the test or admission, very likely admission.
Thank you so much, Prof. Moosa. That really actually puts my mind at ease as well, because I was worried that, look, flu season is coming up. What do we do? Do we go to the clinic or not? And from what you're saying is, don't rush to the clinic with mild symptoms. Rather stay home and self-isolate. And very importantly, don't use the same materials such as utensils with the people that you're living with. Each person should have their own.
Yes. Even if you think it's a mild cough, or in other words, you think it's a flu and not COVID. No, no, no. Please treat yourself as if you're COVID. Any symptoms at all, I'm COVID. You start isolating from the rest of your family. Don't go testing.
And only go to the clinic if it has been longer than 14 days, you have come into close contact with someone who is really sick. And by close contact, you did say not just walking past somebody, but someone where you spent more than 15 minutes with, for instance, and in closer proximity than a meter.
Now, remember, if I can just clarify, if you have shortness of breath, you need to go and test for COVID. If you have symptoms more than 2 weeks, go to the clinic like you just said. But the test we want to do is TB, not COVID, because COVID doesn't come after 14 days. It's an acute condition. The one that lasts longer than 2 weeks is TB. And especially in this condition, and I want to make this especially importantly to people, I urge every single one of you, if you have not tested for HIV, please do. You are the most at risk, especially the one that is not tested and is not on ARVs. If you're on ARVs, you're actually very much safe, especially if you're going taking your medicine regularly and you've checked your CD4 count. But if you've not tested, you're going to be the person that gets it very, very easily because you are immune compromised.
Yeah, that's really helpful. I actually also didn't know that, and I'm glad that you've made mention of that too.
I'm glad. I hope that people will take this disease seriously. Thank you very much.
So you've seen the hotline number on the screen throughout this discussion. We have on the line one of the very generous and courageous doctors who works at the hotline and takes all the general public's questions, and you can imagine how frantic that hotline is. So, Doctor, if you could please introduce yourself and tell us a little bit more about this hotline.
My name is Dr. Sarah Cooves. I am a general practitioner who has worked as a medical advisor for the past 12 years. And it is a great privilege to be here and to be speaking to you today. I think as the COVID-19 disease emerged from China and Asia and Italy to the rest of the world, in South Africa, we were relatively privileged in that we had an element of hindsight to learn from the country's communities and medical professionals that had gone before us and the advice they were giving us in this process. And it was out of the sense of urgency that a group of doctors came together, and doctors across disciplines, across communities, across cities and provinces came together with this common desire and passion to do everything that we can do to help our country fight this intimidating virus. And out of this, the Doctors on Call helpline was born. And I think it was driven by a common desire to offer every service that we can as medical professionals to communities that are potentially more remote and potentially have limited access to medical advice and to speak with a doctor. At the same time, also offering a service to those who do have advice but would just like to make a call and get guidance on the next step and how to manage their symptoms and the procedures. There's a large group of doctors that have volunteered for the service, and it has been an amazing thing because it means that we have the resources to invest a lot of time personally to each caller that calls in. At the moment, we have 5 doctors on call at the same time during our working hours, which are 8 to 5, Monday to Friday. And it does mean that we just can invest capacity and time into each caller and assisting them as much as we can. In the beginning, when we started, we were taking about 70 to 130 calls a day. And as the process has been refined, this capacity is being increased. And it was wonderful to know that yesterday on Monday, we took over 500 calls, closer to 600 calls actually.
Thank you so much. And tell me, what does it feel like to take all those people's calls? What does it feel like for you at the end of the day when you finally get home and get some rest?
Having been quite burdened by the sense of urgency that this pandemic has presented us with, I do feel a lot of empathy for the callers that have called in, and do obviously feel the weight of what they are facing and what the implications are for their communities and their families. But it is a wonderful opportunity to help. And as I said before, the overriding feeling I have had is one of gratitude. I think each and every one of us has got the opportunity to make a difference. And it is a wonderful privilege to be able to do that, to be able to work as a team and as a country to hold back this virus together. I feel that we are so privileged to live in a country where our government has taken a very courageous leadership stance on their approach to this pandemic, and they've given us every opportunity to hold this virus back from devastating our country and our continent. And I personally feel that we need to heed our president's call to pray. My personal prayer is that God's hand would be over this country and be over this continent, and that we would be a success story in the management of this pandemic.
That's it for today's episode. Thank you so much for joining us. We hope you found it helpful. I sure found it very helpful. If you have any more burning questions, please remember to click on subscribe and post any of those comments, and we will try our very best to get your burning questions to our health experts. A very big thank you to Prof. Moosa for sparing his time to come and dispel some of our misconceptions and get some real answers as to what is going on around us and how we should be keeping ourselves safe. And a very big thank you to our volunteer doctor as well. And that's it from me, Masa Kigana, South Africa. Stay safe.